This is part 2 of the chapter 1 lecture notes, and we're starting with slide number 17. We had been talking about homeostasis, maintaining a constant, or the maintenance of fairly constant internal conditions in the body. We listed some examples. Now we're going to talk about how the body does that. How does the body maintain homeostasis? Well, it does it by using a feedback loop, and a feedback loop consists of 3 parts: a receptor, which receives or detects changes in the variable. For example, the variable could be body temperature. The control center, which receives the receptor signal and then establishes a set point and then sends a signal to an effector to get that condition back in control, I guess you could say. So the effector is going to cause changes in the variable so that, like body temperature, so that it comes back to close to the set point. So let's say that this doesn't give you an example, but let's just say whatever the variable is, whether it's body temperature or blood glucose, homeostasis is disturbed. The receptor is going to detect that the stimulus or the variable went too high or too low. The control center is going to receive that information and decide what to do with it. So then the control center will send a signal to an effector, and the effector will cause a response that gets the variable back closer to the set point. And what this is called, what you're looking at here, is called negative feedback. This is a negative feedback loop. So negative feedback means when the variable goes too high, then your body responds to lower it. And it could be the other way. The variable could have gone too low, and your body would respond to raise it back to the set point. So negative means opposite. All right, so a negative feedback is the main mechanism used for homeostatic regulation. Primarily, this is what our body uses to regulate homeostasis. And so this is showing you an example using body temperature. Body temperature is maintained by negative feedback. We have receptors in the skin that detect increased body temperature. So this lady is playing tennis and she is getting hot. Okay, so her body temperature is raising because of her increased activity. So there are receptors in her skin that are detecting that her body temperature is going above the set point, too far above the set point. Now, the hypothalamus in the brain is one of the roles of the hypothalamus is the body's thermostat. So it works like a thermostat. It detects that the body temperature rose, and then, just like the thermostat in your house either turns the heater on or the air condition on, well, the hypothalamus decides, what to do. If the body temperature rose too high, the hypothalamus will send signals to your effectors, including your sweat glands, cause you to sweat, and then as your sweat evaporates, your body temperature will drop. So if it was opposite, if you were too cold, the hypothalamus would send signals to your muscles and cause you to shiver, and your body temperature would raise back to, the set point. But anyway, the hypothalamus is like the body's thermostat. It's the control center of the negative feedback loop that controls body temperature. Effectors can be the sweat glands. They haven't listed other effectors. There's other effectors like the blood vessels. The blood vessels will dilate. The hypothalamus will tell the blood vessels to dilate, and they'll carry blood to the surface of your skin, and then the heat will radiate, will be released from the surface of your skin. So we've got our receptors in our skin that detect increased body temperature. Our hypothalamus is our control center, sends a signal to our effectors, such as our sweat glands, that cause us to sweat. And then step 4, once our body temperature has lowered back to the set point, then the negative feedback stops and the sweating stops. So that's how negative feedback works, is if the variable rises too high or drops too low, negative feedback will reverse it. Okay. And here is the entire negative feedback loop that shows you what happens with body temperature. When body temperature rises too high, it shows you that the control center, which is the hypothalamus, will stimulate the sweat glands. It will cause the blood vessels to relax and dilate. And the response is the sweating and the dilation of the blood vessels together. That combination will cause your body temperature to drop back to closer to the set point. Now, what if you become too cold? Your body temperature decreases. Well, the control center is the same. The control center is still the hypothalamus in the brain, and it will decrease stimulation of the sweat glands. It will cause the blood vessels not to dilate, not to relax and dilate, but to constrict. And that kind of holds in the heat. When the blood vessels constrict or tighten up, it holds the blood in and it holds the heat in. And it may cause like your muscles to shiver, may cause you to shiver, which is muscle contractions. So all of that will add together to raise your body temperature back to the set point. Now, sometimes instead of negative feedback, your body uses something called positive feedback. And that is only for a few examples. The best examples are going to be labor or childbirth and blood clotting. These are the most common examples that you hear about with positive feedback. Almost every other condition in the body is maintained by negative feedback, but positive feedback is whenever you get a stimulus, that stimulus is increased and increased and increased until the process is over. So, for example, when labor begins, it begins with small contractions. Those contractions cause the release of chemicals, primarily oxytocin. And that oxytocin leads to more contractions. And those contractions lead to more oxytocin released. So the contractions basically increase until the baby is born. So positive feedback increases the stimulus until that process is over. In blood clotting, it works the same way. When you have a bleed, when you have a situation where you're bleeding, blood will start to clot, and that will stimulate chemicals to be released. That will increase the clotting. And then more clotting until the clot is formed and the bleeding has stopped. So situations such as labor and blood clotting, these are maintained by positive feedback. Now, most important part of the chapter is the terminology part. This is where you are going to learn anatomical words. If you have taken medical terminology, this is going to be really, really easy. And if you haven't, then it will be new information. Some of it will be new information. But you do need to definitely know the anatomical position. When we refer to the human body in the anatomical position, we are saying that the person is standing up. So standing erect, that just means they're standing up. Their face is forward. Their arms are to the sides, and their palms of their hands are facing forward. That is the anatomical position. So unless you are told differently, you will assume that the body is in the anatomical position. Um, if we say that a person is supine, then they are lying on their back with their face up. If we say that they are prone, then they are lying on their stomach with their face down. Supine and prone, and then make sure you know the anatomical position. When a person is in the anatomical position, they look just like this man right here. Okay? Their arms are to their sides. Their thumbs are facing to the sides. So their palms are forward and their thumbs are the most outside. The thumbs are to the furthest to the left and right of the body. They're pointing to they're facing to the outside. So palms are forward, toes are forward, face is forward, and that's the anatomical position. Then we need to learn directional terms. When we use the term superior, we mean that it's above another structure. Inferior means it's below. Anterior means it's in the front, and sometimes you use the term ventral, but mostly it's anterior in anatomy. And then posterior refers to the back. You can also use the word dorsal. Ventral and dorsal can be used, but we tend to use anterior and posterior. Some other terms would be medial and lateral. So if we say that a structure is medial, then it's toward the midline of the body. If we say it's lateral, it's toward the sides of the body. So for example, the navel is medial to the hands. The hands are lateral to the navel. We also have the terms proximal and distal, and those are harder to explain and harder to understand. Proximal means closer to a major joint. So we use the terms proximal and distal when we are talking about something in relation to the shoulder joint or to the hip joint. Okay? So let's look at this lady right here in relation to her shoulder joint. We would say her elbow is proximal to her fingers. Her fingers are distal to her elbow. And I'm going to say that again, okay? So think about where the shoulder is. Which is nearest to the shoulder? The elbow is nearest to the shoulder, so that it's proximal. And then the fingers are more distant. They're farther from the shoulder, so they're distal. When we compare the elbow and the fingers, we say the elbow is proximal and the fingers are distal, okay? Now let's do the lower leg, or let's do the leg, the lower limb. We're comparing structures in relationship to the hip. So let's do the knee and the toes. All right. The knee is proximal. The toes are distal. Okay. So when we do proximal and distal, we're talking about structures and how close or distant they are from the shoulder or the hip joint. So medial is close to the midline. Lateral is away from the midline. Proximal is close to the point of attachment, the shoulder or the hip. Distal is far from the point of attachment, shoulder or hip. Superficial means it's close to the surface. So the skin is superficial compared to the muscles. The muscles are deep compared to the skin. So deep means it's further. A superficial wound is like a paper cut. A deep wound is if you got stabbed. All right, so that's okay. Then we have upper limbs are going to include the upper arm, the forearm, the wrist, and the hand. Lower limbs are going to include the thigh, lower leg, ankle, and foot. And then the central region, the trunk is what the central region is called. Now, you need to know these terms absolutely, like you need to be able to say them, spell them, without any help. You need to know all of these terms, and you need to spend some time learning these terms, okay? These are the anatomical regions, is what we call them. So basically, forehead region is frontal, eye region is orbital, nose region is nasal, oral region is mouth. Okay, and I'm just starting at the top on the left side of the page, which is the right side of the body. And I'm just moving down. So the neck region is cervical. The chest region is thoracic. We call the chest the thorax. So the chest region is thoracic. Now within the chest region, there's also the actual chest itself. So pectoral is used to describe the chest, especially when we're talking about the chest muscles. But the chest cavity is thoracic. Okay, so when we use the word thoracic, we mean the chest cavity, which includes like the heart and the lungs and just everything inside the chest cavity. But when we use the term pectoral, we're talking mostly, we use that to refer to the chest muscles. All right, in the middle, we have the breastbone, which is the sternal region or the sternum. We have the breast, which is the mammary region. And then down below, we have the abdominal region, the abdomen, the umbilical region or the navel region, umbilical. And then for the pelvic region, we have the pelvis, the inguinal or the groin area, and then the pubic, which is the genital area. So those sometimes can be easy to get mixed up, pelvic, inguinal, and pubic. The ears are otic, the cheeks are buccal, the chin is mental. The collarbone is the clavicle, and so we call it the clavicular region. The armpit is the axillary region. The arm or upper arm is the brachial region. The front of the elbow and the bend of the elbow here is called the antecubital region. The forearm is the antebrachial region. The wrist is carpal. The hand is manual. The thumb is the pollex. The palm is called the palmar region. And then the fingers are called digital. The hip is coxal. The thigh is femoral. The kneecap is patellar. And the shin is crural. Crural. Kind of hard to say, but that's the shin. And then for the foot region, the foot is pedal. The ankle is talus. The ankle bones are called the tarsals. And I don't know why it's not worded that way here, but the ankle bones themselves are called the tarsals, like the wrist bones are the carpals. And then the top of the foot is the dorsum, the dorsal region. The toes are digital, and the big toe is the hallux. Okay, in the posterior view, the base of the skull is the occipital region. The skull is the cranial region. Back of the neck is called the nuchal region. The back itself is dorsal region. The shoulder blade is the scapular region or scapula. The spinal column is vertebral region. The lower back is lumbar. Between the hips is the sacral region. The buttocks are gluteal. And then the perineal or perineal or perineum is the area between the anus and the vagina in a female. If you start at the top on the right side, you have, we already did that the skull is the cranial region, the shoulder is the acromial region, the elbow is the olecranon, the olecranal region, back of the hand is the dorsum, the back of the knee is popliteal, the calf is sural, the bottom of the foot is the plantar, the sole of the foot is called the plantar region, and then the heel is the calcaneal region. So we will finish up with part 3, and that will start with slide number 33.